Hi, thank you for staying with us. I know it's about a lunchtime, and I will use the next 9 minutes to give a quick insight into our view of the world in terms of cognitive systems, artificial intelligence, and what we do with it in healthcare and in oncology in particular. So thank you for staying 9 more minutes, and I will be very focused to be on time. My name is Matej. I'm in IBM Healthcare for last over 15 years, and I'm leading Watson Health business in Europe for last year and a half, and very excited to have an opportunity to be part of this today. So if you think about what's happening, a lot of the notion here in the conference about disruption and what happens and what will happen, I would say it absolutely is happening, and we are living it. We are living it. If you think about biggest taxi company Uber having no cars, biggest accommodation business Airbnb having no property, no beds, but they are the biggest in the industry. It is happening. So I think the question we need to ask ourselves is what's our reaction on this? Are we going to take advantage? Are we going to shape what's happening, or are we going to be left behind and it somehow comes to us like globalization came to some of the unprepared corners of the world, and it wasn't a pleasant experience. It's a lot about, and what we do is a lot about new era in computing, cognitive systems, artificial intelligence, and in practical terms, what it means and how it comes to is through three particular enabled functions which these systems can do. They understand various sources of data, especially unstructured text, free texts, articles, studies, very difficult for traditional computers to understand. You can't program it, it's just too complex. Reasoning. Cognitive systems can formulate hypotheses and can suggest a rationale based on which the hypotheses were moved forward. Very much like we as humans do when we are looking for arguments. And then learning without tapped, without ceiling of capacity, machine learning in a huge scale, and continuous improvement. So it sounds interesting. It could be also scary. Now, what's very important to say is that especially from our perspective, what we do with Watson and what we do in IBM, it is absolutely not about replacing humans, about replacing doctors and nurses. It is about helping to augment. We actually use the term augmented intelligence rather than artificial intelligence, because we can help and augment the existing capabilities. And if you think about, what is defining us as human beings in terms of morals and emotions and compassion and so on, computers will never be there. But in the same time, access to knowledge, not forgetting things. I'm forgetting things all the time. Structuring the unstructured. That's really where we can tap into a lot of help and capacity from cognitive and systems. And the partnership is really important here. Now, why it's important in healthcare? Healthcare is just drawing in data, and we are just scratching the surface. We are somewhere down here in terms of having a lot of clinical information which hospitals and pharmacies and general practitioners and other professionals are creating. It is very rarely tapping into genomic data, and it is not tapping at all into the data which are very important, which is about how we behave, how we eat, how we exercise, how we sleep, and so on. Today, it's already created with our phones, with our Fitbits, and so on. And how this data can come to a professional, to a doctor, to a consultant, to make a decision, to make a consultancy based on that, that's a long story. And you need to have technology and engines which are really enabled for these massive amounts of data and terabytes, which we generate as individual human beings over a period of our life, while the impact of healthcare systems compared to impact of how we treat ourselves is very different. It is really about how we behave to ourselves, what we do, more than the quality of healthcare system. So we have created Watson, which is a platform for artificial intelligence in IBM, and we've taken it to healthcare. We have taken it to oncology and genomics. We are training, and we are already using it here in Poland also, in one of the hospitals, for helping oncologists with clinical decision making on cancer. We are training it on imaging for being able to see and analyze medical images. We're working with life science pharma companies for researching new drugs, for repurposing existing drugs, for pharmacovigilance processes. And we are working with health providers, with government, and with payers on value-based care, on transitioning from paying for volume, which is the way how most of the systems are paying for healthcare, to pay for outcomes, and it needs to be based on this big data over years. We ourselves built up a database of 200 million longitudinal healthcare records, which is a great reference base and also training base. And we are also working with the consumers. We've specifically focused and started with oncology. And the reason for that, it's probably the most complex problem out there in terms of a medical field. The reason is that it's just so many information. If you look at every year, it's about 70,000 new studies about cancer. And if you take a single disease like a breast cancer, over 3,000 studies per year. It's just not possible to keep up with that. And if you put it into a little math, you would be asking oncologists to read every day more than 24 hours just to keep up with that, which is of course not possible. They don't have time. So the opportunity to bring in technology like Watson is enormous. And what we've built and we are continuing to develop is an oncology platform, which has three components, and we are building it forward. First, we have a decision-making clinical support system, where after there's a newly diagnosed patient, you bring the parameters describing the disease, like stage, size of the tumor, results from lab, results from pathology, and so on. It provides prioritized treatment options on which combination of drugs, which combination of therapies could be used to treat this individually profiled patient. And we are already implementing it in over 60 hospitals around the globe. And we are also working here in Poland and in other countries in the neighborhood. We have a system for better clinical trial matching and to make sure that the opportunity of putting patients who are not responding to existing treatment on clinical trial is increased. And we also have trained Watson for understanding genomics. We have a system where when someone's doing DNA sequencing of mutated cells caused by cancer, we can, within a few minutes, interpret those big files, these big data files coming out from sequencers of next generation, and provide analysis of what are the mutations, what are the mutations driving cancer, what are the therapeuticals, what drugs will work for it, and what are open clinical trials. And we are working forward bringing real-world evidence data, cost data, to make sure that oncologists and other professionals can really tap into this vast, field of knowledge when they are making the decision about the patient in the real time based on individualized patient profiles. Thank you.